Is there a limit on Medicare cost sharing? Are you curious about whether there is a limit on Medicare cost sharing? Understanding this can be essential for your retirement planning. Let's break it down. Medicare cost sharing includes the out-of-pocket expenses that beneficiaries pay for healthcare services. This can involve deductibles, co-payments, and co-insurance. For retirees, knowing these costs is vital for effective financial planning. When it comes to Original Medicare, which consists of Part A and Part B, there is no strict annual limit on out-of-pocket costs for most services. This means that if you're requiring a lot of healthcare services in a year, your expenses can continue to rise. For instance, in 2025, the annual deductible for Part B is $257. After meeting this deductible, you typically pay 20% of the Medicare-approved amount for most doctor services. This can add up quickly, especially if you have frequent medical visits. On the other hand, Medicare Advantage plans, also known as Part C, are offered by private companies as an alternative to Original Medicare. These plans do come with an annual out-of-pocket maximum. In 2025, this maximum is $9,350 for approved services. Once you reach this limit, the plan covers 100% of the covered services for the rest of the year. This feature is particularly beneficial for retirees, as it helps protect against unexpectedly high medical bills. Medicare Part D, which covers prescription drugs, has its own cost-sharing structure. While there is no strict out-of-pocket maximum, there is a coverage gap known as the donut hole. Once you reach a certain spending level, your costs for covered drugs significantly decrease for the remainder of the year. The specific thresholds and limits for Part D plans are updated annually, so it is important to stay informed. For retirees, these cost-sharing mechanisms mean that choosing between Original Medicare and Medicare Advantage can greatly affect your potential out-of-pocket expenses. If you prefer more predictable costs, a Medicare Advantage plan with an out-of-pocket maximum may be more appealing. However, if you value the flexibility of Original Medicare, keep in mind that there is no annual limit on most services, which could lead to higher costs if you're requiring extensive care. In summary, while Original Medicare does not have an annual limit on cost sharing for most services, Medicare Advantage plans do offer a set out-of-pocket maximum. Understanding these differences can help you make informed decisions about your healthcare costs in retirement.